This Good to Go segment is sponsored by Spectrum Health Medical Group.
Lots of people complain about pain and stiffness in a knee, hip, or shoulder. But if your pain is severe and it's affecting your quality of life, you may be a good candidate for joint replacement surgery. Corewell Health West, formerly known as Spectrum Health, has a long history of excellence in helping patients with joint pain improve their mobility and get back to living their best life. In fact, they perform more than 100 joint replacement procedures each month in West Michigan. Here to talk about the latest in joint replacement surgery is Dr. Chris Sherry from Corewell Health West Orthopedics. It's good to see you, Dr. Sherry.
Thank you so much for having me.
Yeah, let's start. Let's just talk about what joint replacement surgery is.
Sure. Joint replacements are options for patients that have end-stage or severe bone-on-bone arthritis in their affected joints. When these patients start having debilitating pain that's really affecting their quality of life, we can discuss these surgical procedures that basically eliminates the arthritis in their affected joint and allows them to return to the level of activity that they want to pain-free.
Talk about who's a good candidate for this.
Sure. We look at patients that have end-stage or severe bone-on-bone arthritis. They failed conservative treatment options or non-surgical treatment options, and they continue to have daily debilitating pain that affects their quality of life. They're not able to do the things that they want to do or live the life that they want to live. At this point, we start talking to patients about potential surgical treatment options to eliminate that arthritis and get them back living the life they want to live.
How do you replace the joint?
It's different for each joint. Basically, we're reshaping the ends of the bones on the ends of the affected joint. I do have a knee replacement here to try and give you an example.
Oh, good.
With the knee replacement, we're basically making geometric cuts that go around the ends of the bones, replacing the ends of the bones with metal and also a piece of plastic in between. And this eliminates the arthritis in the affected joint and allows the patients to return to normal activity without that arthritis-related pain.
I imagine you've seen a lot of changes, both in the product, the replacement product, the procedure, and the outcomes for patients over the years.
Absolutely. It's always a procedure that's evolving, getting better as years go by. We're seeing some significant improvements over the years. One of the big things is we're seeing the increased longevity of the joint replacements. These joint replacements are lasting longer. We're not as concerned about doing these type of procedures in younger patients that have severe arthritis that affects their quality of life. We're improving outcomes. We're shortening length of stay in the hospital. We have better pain control methods to help speed up recovery and help with the rehabilitation process. We're even doing these as an outpatient procedure now, which patients are coming in, they're having their joint replaced, and they're going home the same day.
That
That's
is
been pretty
amazing. Yeah.
pretty exciting development for us.
You mentioned that the joints are lasting longer. How long do they last? And do they, when they go home, like that outpatient procedure, are there restrictions that come along with that?
Sure. Our data shows us that the older generation of joint replacements were lasting generally 15, 20 years. We're using more wear-resistant parts for the replacements. And we're still waiting on long-term data to come back, but we're very hopeful that these newer generation of joints gets far beyond that 20-year point from a longevity standpoint. As far as restrictions, there's not a whole lot of restrictions when we talk about these joint replacements. Generally, we try to tell patients to stay away from repetitive, high-impact type exercise, but really getting back to your normal day-to-day routine, walking, biking, swimming, playing sports like golf and tennis are all very reasonable expectations to have after joint replacement surgery.
It's got to feel like a new lease on life. What do you say to someone who thinks they might be a candidate and is contemplating, like they've reached the end of the line, they've tried everything else, I guess?
Sure, we encourage these patients, call your local Corewell Health orthopedic specialist and get evaluated. There's lots of different options. Surgery may not be the right option for you. We'll talk to you about more conservative treatment options, but if you've kind of failed these things, continue to have significant pain and disability in life, then you might be a candidate for a joint replacement surgery, and it can really affect your quality of life.
Yeah, for sure. All right. Well, folks, you can learn more about joint replacement surgery by calling 616-267-8860 or go to spectrumhealth.org. Thanks, Dr. Sherry.
Thank you so much.